welcome to Time for Health. We're very glad you've joined us. Every time we get together, we talk about a different health topic that hopefully is helpful to you or somebody you know and love. And as always, I always say the disclaimer, don't start or stop anything that you're normally doing without checking with your healthcare provider first. Today, we are talking about diabetes prevention, how to prevent diabetes and prediabetes and all kinds of cool things. And we have Tracy Stadler with us, my colleague from Magruder. Thank you for being here.
Thank you for having me.
You have many titles after your name. You're a dietitian, director of food nutrition services, and a certified diabetes
education, care, and specialist.
Yes, that. So thank you for being here. So, we hear diabetes all the time, but what is diabetes? Let's start there.
So simply, diabetes is a disease where your body just isn't using the food the way it used to for whatever reason. If your body's insulin isn't working, other things going on.
Okay. And so in recent years, there is now prediabetes.
Yes.
So what is that?
So prediabetes is what we used to call borderline diabetes. Now we've given it a title. Prediabetes is the early stages of diabetes when your blood sugar is running higher but not high enough to be called diabetes.
Okay. I heard a doctor talk one time and they said that's why it's important to check your blood pressure or blood sugar, that it's not over the level of diabetes, but it keeps creeping up.
Yes.
That's kind of in the area of prediabetes?
Yes. So if you do end up being in the ranges of prediabetes, it is not a given that it will progress to diabetes. There is something you can do about it at that point. Keeping an eye on it, having your blood sugar checked if you are able to have a glucometer at home and check on it. Yes, to make sure that it doesn't start creeping and get out of control.
Into diabetes.
Because it can happen.
Yeah, but it doesn't have to.
It does not have to.
And so there is a screening tool on the diabetes.org and the CDC website, like a prediabetes screening form.
Yes.
Is that where somebody can find out if they kind of fall into that prediabetes category?
You can find out, yes, we call it the prediabetes risk test, and there are just several questions on there that you can answer and share with your physician. If you find out either you are in that prediabetes stage or at risk for it.
Okay.
So the higher the number that you score, the higher your risk is for it.
Okay, and it's not just blood sugar that they're looking for. There's other, it's just a
correct.
Other questions.
Your age, your activity, whether you're male, female.
Okay. So there's a screening form that somebody could take just to see if they are at risk for developing prediabetes or diabetes.
Correct, and you can find that, like you said, at the American Diabetes Association website, diabetes.org, or at the CDC website as well.
Okay, so you could take that screening form, and then is that something you review with your doctor or nurse practitioner or whatever?
I always encourage our patients when they fill it out, or if someone were to call me and say, hey, I just filled this out and it's pretty high, that's when I'll say share it with your physician. See what he or she thinks. Do we need to get together and kind of get a handle on this now so it doesn't get out of control for you?
Okay. So there is now an evidence-based diabetes prevention program that you guys have been certified in and are working on doing sessions.
Yes.
So talk a little bit about that program.
So the diabetes prevention program was it is through the CDC. Years ago, it started out as a program that was done in YMCAs. And that kind of graduated from there, and it's done any place now. However, there is a stipulation. I say any place, but you do have to have the recognition through the CDC.
Right.
So there are, some different levels that you have to go through and send them data and that, and then they recognize you and you have that certified program, which is a program now that yes, we are doing at the hospital. We have done one.
Okay.
It is a year-long program.
Okay.
I know it sounds like a lot, but I will tell you, even though we were a little leery, we had an awesome first program.
Great.
We had a lot of success with it. We do meet weekly for the first 6 months. For the second 6 months, then you have to meet a minimum of once a month. But I believe we still met every other week at that point too. We do some fun things throughout the program. There is a curriculum that we follow
Right.
through the CDC,
Sure.
but then we can do some other things in there, like maybe some food demos, some recipe demonstrations and stuff like that. So we had a really good time with the program. So we are going to be starting another one
Okay.
here coming up in November.
Okay. And so, like you said, you meet weekly, and to some people that may be like, oh, I just can't, I'm too busy, or I can't do it. But I know your diabetes education program, when somebody is diagnosed with diabetes, type 2 diabetes, that is
Much
also
longer commitment than the
Yeah.
12 months for the diabetes prevention program.
Yeah.
Because, so yes, you're correct. Our program, so you know, is just the 12-month. However, the application that we applied for was a combination of both in-person visits and virtual visits, hopefully to make
Okay.
it easier for
Oh,
the
sure.
working population, you know,
Sure.
if they need to be a part of that. The meetings are never longer than an hour.
Okay.
So it's a fun time.
Yeah, and so you
It's
just kind of, during the program, you touch on all the different areas of health and wellness. to
all
kind
different topics: healthy eating, activity, getting enough sleep, stress management, just those types of things to improve your lifestyle, to help promote some weight management. And maybe before you started the program, your blood sugar was maybe right here, but maybe by the time we finish, it's down this way. So keep in
Gotcha.
mind that, again, prediabetes is reversible.
Okay.
It does not have to progress.
Have to go to. It's kind of like doing the all the other health screenings that you want to catch things early before it progresses into an actual diagnosis of diabetes.
Correct. Correct.
Yeah. How do you I think there's a couple ways to test your blood sugar.
So usually at the age of 45, I believe it is, your provider should be doing yearly lab work on you
Okay.
and testing a fasting blood sugar on you.
Okay.
So you can do that. We also have another lab value. It's called the hemoglobin A1C, where it looks to see, it's like a 3-month average of your blood sugars
Oh,
is what
okay.
it is.
Okay. And that's something you work with your physician that
Correct.
you need
They
in
would
order.
do that for
Okay.
you. So getting screened once a year is a great way to keep your labs in check, to know if you have that possibility of, you
Yeah.
know,
if it's still normal, but
increasing.
it's creeping.
creeping up on you. Exactly. Now, if somebody has a strong family history of diabetes, they start checking the blood sugar earlier than the age of 45.
Okay. So I know you do some other programs at the hospital with diabetes support programs. So again, you would really like to do the risk test first to see if you're falling in the pre-diabetes so you can prevent it. But when somebody has diabetes, you guys also have your diabetes get-togethers that you do?
We do. We do monthly groups. We call them our diabetes get-togethers. They are the first Thursday of every month at 11 o'clock at the hospital. At this point, we don't have an RSVP or anything, but you just show up at 11 o'clock at the hospital, and what we do, it's an educational session. So it's not just coming together like a support group would be. Either I am there, or I also have our nurse, Amanda, who's also a certified diabetes care and education specialist as well. So either one or both of us will go over a topic then, and then we do just talk and answer any questions,
Sure.
you know, that have been just on
When
someone's
I've
mind.
been out at festivals or different things with the flyer, I say it's like part support group, part education
Yes,
program.
exactly. I think that's helpful because I think support groups are awesome. They truly are. But sometimes I think it holds people back, just, you know, depending on the person that doesn't really open up as easily
Gotcha.
in front of
Oh,
other
sure,
people.
sure, sure.
So when we start out by talking, and there's more engagement that way, and they may be more apt to start asking questions
Gotcha.
or something.
Okay. So you've got the whole gamut. We've got the risk test and the pre-diabetes prevention, but you also have tons of.
Yes, we have
you
our
have your-
diabetes
you have
education
diabetes
program as well.
education and then the get-togethers. Any last minute thoughts in terms of the diabetes prevention program that you want people to know about?
So November 7th is the start date for
Okay.
our next program.
Okay.
And the next Friday, I believe it's October 21st, is the deadline to sign up for that. So if you know that you are at risk, call the hospital. We can give you information on the program.
Okay.
You do not need a physician referral for the program.
Okay. Oh, okay. That's a
Yes,
don't need a
I
referral.
think that's really important.
Self-referral. You could just
correct.
call in. Now, this video will, be out there for a long time, I hope.
Yes.
And so if they miss this session, still call the hospital
Call
to get
me
more.
anytime. Just call the hospital, ask for diabetes education department. Again, my name is Tracy. Just give me a buzz. I can fill you in on any upcoming programs, when our next program would be starting. Our goal is to be having 2 diabetes prevention programs going on at one time. So
Gotcha.
start one, and then if 6 months later, start another one.
Okay.
So
Very cool.
we'd love to have you join our program. Give us a call, and we'll just have a great time.
Yes,
It's great support, and it's fun.
I have no doubt you will. Thank you for being here.
Thank you for having me.
You got it. So lots of resources out there for anybody who has a family history of diabetes, or if you have taken the risk test or think you might be at risk for diabetes. There's all kinds of resources out there. So take this information. Hopefully it's useful for you or somebody you know and love. And until we meet again, I encourage you to make time for health.